Hello everyone, I'm Prajakta Marwaha from No One Care, and today I have Dr. Abhay Chopada from MedTech Talk, a renowned surgeon from UK and expert when it comes to technology and healthcare. His profile is impressive, but what if I have to describe him in one word? I will say one of the most visionary healthcare professional I came across. At No One Care, as we all know, we discuss our society issues on daily basis, but few of us care enough to take an action or discuss about them. Let's talk about them. Today, we are going to talk about remote healthcare issues faced in India. Like law for a lot of us, healthcare is necessity, but in remote area, it is luxury. So let's see how we can discuss this topic, find some solution, and see how we can contribute from our side. To start and make it little lighter note, Dr. Abhay, I would like to ask: you were born and raised in India and have worked for more than 2 decades in UK. What major differences do you see between healthcare in UK remote areas and healthcare in Indian remote areas?
Thank you for your kind words, Prajakta. But let me just put the context right. So I was trained in India. I was actually a fully qualified surgeon in India before I came to UK. And then I've done my fellowships here, and I've been a consultant surgeon for more than 20 years now. Let me just tell you, these are two completely different worlds. Rural Indian healthcare was practically dependent only on public health and non-existent, which meant that the availability of any resources was extremely limited. I still remember I used to do clinics in around Shirur, and the only medicines we had in order to prescribe was paracetamol, and occasionally we used to get some amoxicillin. So even when you were a doctor, even when you knew what you needed, the resources were just not always available. Contrast that to UK. In UK, rural areas are actually fully served by the government. In fact, a lot of rich people prefer to live in the villages. And the reason is they like the idyllic lifestyle. The hospitals are fully, uh, well stocked, well resourced. Everything is available. So there's a contrast. It's almost like chalk and cheese. We're looking at an Indian health system where a lot of our poor people are desperate for care and they have nothing. And then I have the rural setup in UK, which is actually pretty well off. A lot of rich people, they've got everything. So we genuinely can't compare the rural aspects of India and UK from that perspective.
Okay, actually, my next question was, can we close the gap between, in the Indian scenario? But I don't think from your answer there is,
You'll be
currently it is
surprised.
possible.
Actually, the answer is we absolutely can. In fact, we can do
Okay.
better than UK. And let me start with what I've been doing and why I see this as a huge opportunity. Healthcare is also transforming. Healthcare also is something that has actually evolved over the last 50 years, 20 years, 10 years. What India has, which even Britain is behind, is access to talent. We've got an excellent digital infrastructure, and you'd be surprised that our financial ecosystem in India is way superior to anything in the West. Today, even the smallest of Indian grocers will take your Paytm. You just scan a QR code and your transaction is done.
True.
Now, let's just for a moment pause, take a pause back and say, why can't we use a similar thinking to transform our rural healthcare? And why just rural? Why can't we make India the health superpower of the world? And now let me qualify this by explaining to you why I say this. India exports the best medical talent in droves every single year for the last 50 years. All our best doctors have migrated to Australia, to UK, to US. Go to any country in the world and you go to any hospital, you'll find there are a lot of Indians. So the talent was obviously there. Then why couldn't we retain them in our country? We
Hmm.
couldn't retain them because our infrastructure wasn't ready. These people are obviously ambitious, and we need to give them a way in which they can re engage with our society. Today, you'd be surprised if I tell you that I personally will look after at least 5 to 6 patients a week. And they're not even physically here in UK, they're all in India. I just get their reports. I look at it, I give my opinion, I talk with my friends, I get their problem solved. So now let's come back to what I was saying. How can India be a health superpower? If I've got access to medical talent and the talent is available in India, why can't I do the same thing that happened in IT sector? Why can't I allow everyone in the world to access a doctor in India, take the same opinion, and actually serve it? And this can be exactly the same model where the doctor can sit in the city and he can treat the patients either in the village or in the US or in the UK or in Australia.
Okay.
How is this possible? A lot of people confuse this idea with telemedicine. And telemedicine was the first time we started thinking about how can we see people remotely. But telemedicine was first introduced in 1974. That is more than 70 years ago now.
Yes.
So why did it not take off? It did not take off because doctors are pretty unique in the way we think and we behave.
Okay.
You'd be surprised that doctors don't just want to talk with the patient, they want to examine the patient, they want to have the right context, and they want to actually be empowered in order to take the right decision. There's one thing the doctor will never do: take risk.
Okay.
So today, if I have the digital infrastructure whereby the patient's medical file is available to the doctor, he can then ask the patient whatever information he wants. Then he can examine the patient using technology. And then he can maintain the high standards based on where the patient is coming from, the context, the protocols of that local area. If I can get all these four things sorted out, the world is going to get transformed. Let me come back to the rural problem and let me tell you
Yes.
why my heart is so much into rural India. Like you, I've spent a lot of my childhood in the villages of India.
Yes.
Both my grandparents came from villages. I was fortunate, I grew up in Pune. But I've seen the problems. My own grandmother died because she bled during surgery and no one could save her.
Okay.
Why is that even happening? It's happening because the right skills are not available. When I want help as a doctor, I can't get help. When I actually want to make a decision, I don't have specialists in the village. So things take a lot of time before the problem is diagnosed, and a lot of people lose their lives because this condition is picked up pretty late. And this again is the same problem that I can solve with digital connectivity. But it is not simply about saying that, oh, we will just give you a telemedicine platform. Combined with the telemedicine platform, you should have systems which offer the doctor the ability to deliver his entire care episode in one go. Let me put it this way: if I actually had a Kannadi patient today in Pune, I can't look after him
Mm.
because I don't speak Kannada. But what if
Okay.
it's Kannadi? I hear it in Marathi. I have technology to do that today. Let's assume someone's speaking Swedish and I hear it in English. Then you can start solving all these problems. And in fact, that has been my mission over the last 5 years.
Okay.
Healthcare can be transformed. You just need to be able to see the potential and
Oh,
trust yourself. It will be delivered.
true, true. So you are answering, like, most of my questions in advance, but to ask, so what the apart from the facilities, what, in your opinion, affects the reach of healthcare to the remote areas?
So there are two things. One is you have to make everything local. See, rural areas are no different. They have communities. They have communities which own things. And remember, one of the most successful Indian programs was the Anganwadi program, when we
Yes.
trained the local people to look after local people. When I looked at schools in India, schools do very well because they are done locally. When a child can go to a school which is close to his home, then he's definitely going to get access to education.
True.
Transfer the same thought. Why can't I make it local? Now, when I say local, I don't want a villager to go to the town place or to the city for every episode. Neither is it practical nor is it effective. But what if I get the specialist in the village? And this has been a problem which the government has been trying to tackle for the last, as long as I know. They're trying to put
Mm.
doctors in villages, and doctors refuse because they don't like the lifestyle of the villages. The main problem is, oh, I can serve in the village, but what of my child? My child won't get education. My child won't get access to the best things. So our model is saying, listen, we will put the infrastructure. The doctor can stay wherever he is, but we'll empower the local people To act as the doctor's assistant, I can take an Anganwadi worker and make her a doctor. Now you might say, how? I'll tell you, it is literally about empowering her about what questions to ask, what examinations to actually help the doctor with. The actual work will be done by the doctor. But the Anganwadi worker or the local, person can be trained to help the doctor remotely. And that means that your care will still be offered in the village. And I can actually pull you into the city only if the health condition demands it. If I feel, he needs to be admitted in a good hospital, I can have an ambulance pick you up and get you to the hospital. But we have to think outside the box. Everything is doable. You need to believe that it is possible, and you need to start doing it small pieces and parts.
True, true. It's like, a lot of things we need to bring together to make this successful. I would like to discuss one. The last month we did one health checkup camp in Latur where we tried to screen 1,000 females, ASHA workers precisely, for the breast cancers. There were few who came out up with some concerns and all. The technology was pretty good, like the small machine where you were able to, instead of the mammogram, you were able to scan the technology through that technology within 8 minutes, painless, and lot of things. What are other technologies you think we can bring which can solve the concerns, like I have last time also discussed like pregnancy issues and all. So can you put light on some technology products or solution you think can solve these issues brought together?
Absolutely. But first, let me congratulate you for the amazing work you're doing at Akka Foundation. To
Thank
screen a
you.
thousand breast patients is amazing work. I'm sure you've saved quite a few lives. But remember, what the breast scan, which is what you used at your camp, is it just one device. Now, what you really need
True.
to start thinking is there are hundreds of such devices, all of which can be used for individual conditions. But this data needs to flow in the correct fashion to the doctor, along with the context. So it has to be a fusion between hardware, between software, between AI, and this all has to be offered to the doctor in the way that he needs it so that he can make his assessment. I'll give a very simple example, something that I presume you have done already, which is scanning for oral cancer. And you've got this
Yes.
Aura scan, which I'm well aware of. Now imagine that if everyone in the village who's using tobacco just gets one checkup a month, where we can actually look into their mouth and just look for leukoplakia, which is very easy to see. Potentially, you're going to stop a lot of people from developing the cancer because you can treat the leukoplakia. You can stop them using tobacco because you can show them that, listen, you're otherwise going to get cancer, right? But who
Yes.
understands leukoplakia? It has to be a doctor. Now imagine if your aura scan is connected to a system where a maxillofacial surgeon or oral surgeon is sitting in Mumbai or in Tata Memorial, and he's screening thousands of patients in 20 minutes because all he has to do is see the images, right? And he can point out, okay, these 20 people need to be brought back and I want to talk with them because I think they're in trouble. Now, suddenly, what we've done is we've transformed his ability. Instead of seeing 1,000 patients individually, what we've done is we've taken 1,000 images, used an AI model, screened it, found out the 20, and only 20 consultations will happen.
Fabulous.
So you have to think outside the box. How do you leverage what technology offers you, what the doctor needs, and how it solves a problem? I can assure you that this can be extended to solve maternal mortality, child mortality, malnutrition, the major challenges of our country. Again, as I said, it is not restricted to any single area or a single problem.
Okay.
The way it should work is you give us a problem, we'll devise a solution, we'll implement and prove it to you that it has value, and then you can scale it up. So, any problem can be solved. As I said, okay, if we take it and if we are keen that we want to solve a problem, then nothing is impossible.
True. So the issues, what you are saying, so according to you, which should be the five most prominent healthcare concerns in remote areas which need or which can immediately, with the help of technology, can be solved?
Starting today, okay? First,
Uh,
chronic diseases. especially looking after cardiovascular health, doing blood pressure checks, doing simple ECGs for villages. Because what you can do is you can pick up problems in advance. Why can't I actually say, okay, let's screen them for cardiovascular diseases, your number one killer?
Hmm.
Diabetes management in villages. You can do it through my health ATM, an amazing thing we've put together where actually I can do all the assessment and only if they need, we can connect them to a diabetologist. Child malnutrition, put it in schools. Put a health ATM in the schools. Pregnancy management to reduce maternal mortality because it is highest in rural areas. You don't find that much maternal mortality in the cities. And last but not the least, mental health issues. I'm telling
Hmm.
you, we ignore the biggest elephant in the room. Why can't I put mental health in every village? Believe me, the productivity of the village will go up so fast. Addiction, depression, truancy, delinquency. This is all very common in rural areas because we've never thought that mental health is a big problem in rural areas.
True. Even I don't feel so, but yes, there are, like, because of due to unemployment, access of resources, lot of concerns are there definitely in the remote areas, which need to, which leads to all this kind of addiction, depression.
Yeah, but we can actually use the same people and make them employed and make them help other people and create a business out of it. Believe you me, there is no such thing as wasted human talent. If I take 10 reasonably educated but depressed youngsters in a village and say, hey, listen, I'm going to make you health assistant and health attendants. Can you look after the village? Now, suddenly, they're going to earn their living after looking after the village. I don't have to pay an expensive doctor to come and stay in my village. So you have to
Which
rethink the
might
way
not,
we.
because of whatever, the dynamics for the healthcare, it's quite difficult for a doctor to travel all the way to remote areas. But yes, with the technology what you are mentioning, it's quite possible to reach villages online.
Absolutely. So it's not just that. Again, we have to think in terms of rural communities as whole. And we have to say that, listen, we will give them the resources that they need, but we'll also develop their local skill sets. See, ultimately, even with technology, I still need human input. I still need someone to help the doctor who's sitting remotely.
True.
I still need to create a sense of purpose in that rural community. Would a rural pregnant woman want to see a male doctor from the city? The answer is no. She won't be comfortable. She'll feel intimidated. But if I have a local girl who is from the community, who's trained, and there's a female gynecologist in the city, she'll be very comfortable. Because from her perspective, she's seeing someone whom she knows, whom she can reach out if there's a problem. So again, we can think of this initiative not just as transforming health, but also transforming communities. As I said, if we start doing this for rural India, believe you me, we can also start looking after the rest of the world. Why can't my health attendant in Latur or let's say in Shimoga look after a rural village in Africa?
True.
Now you're going to say language is a barrier, but as I said, technology can solve that barrier. Someone is speaking, let's say, Swahili, and I can hear it in Marathi, problem solved.
Okay, is it possible, like, because what kind of, I know AI can do this, but when it comes to, because I have this question myself, the healthcare language is different. The doctor understand a different language. Don't you think there are different aspects which needs to be covered? Does Exon Care take care of that aspect?
Absolutely. And think differently. I'll explain it to you. Uh, do I always understand what the patient's telling me? The answer is no. I will put a context. I'll roughly understand what you're telling me, right? Even when we speak the same language. But let's assume if I want to know 20 bits out of your information and I send you a template in your own language. Now you are going to give me the answers and I don't have to ask you the questions. You have the time to put it in the correct context. I can get them translated and make a rough sense out of it. That's the most basic that is available even today. But let me tell you what we've done at Axonic. We've used the context part by sending the template to an LLM, giving it the right context. Now, LLMs are very smart. They understand, yo, this is misinterpreted. This has to be retranslated because the context is right. They give me such an accurate medical summary, and that's a part of the axonic solution. So
Okay.
certainly, what it is doing, it's empowering the doctor. I don't have to spend my time. My
Hmm.
system automatically tells me what is the problem of the patient in my own language, which is the medical language.
Hmm.
And this can happen from any language. Now, suddenly, like I said, if we do it smartly, it is possible. It is doable. It's not just doable, it's already happening because, like I said, I do it already. So I'm very confident that, yes, that's a solved problem.
Oh, that's fabulous. That's very good to know. I think that's where, we all would like to know ki there is something which help us to communicate in any language, especially to the doctors. That means you are saying ki a remote area in Latur, a patient in Marathi can talk to someone in UK in
Absolutely.
English? Oh wow, that's
Why?
nice.
We can even speak with someone in Sweden or someone in Denmark.
That's like, very impressive, and I think this is the way which we need to start, or we need to look at the healthcare. Okay, there is like I think different question which I comes in my mind always, since I being from a remote area, like to have always believed in little bit of traditional medicine and local healing. What is your opinion about it? How can a traditional medicine and local healing component very well with modern health tech?
You know what? This is a perfect question. I was waiting someone asked me this. Remember, traditional medicine has been around for thousands of years, and it is not hokum. I'm telling you, my grandmother used to ask me to take turmeric if I had a sore throat. Today, I
True.
know that turmeric has been proven to have antibacterial properties. So just because I didn't understand how it worked, didn't make it hocus pocus, right? What we have to do is we have to understand local traditional medicine. We have to educate and find out and let people discover why that medicine was effective. Open up your minds to say, you know what, traditional medicine has a huge role because it's traditionally available. I'll tell you a very interesting thing. A lot of allopathic doctors are now actually trying to learn Ayurvedic principles because Ayurveda makes a lot of sense. Ayurveda is very similar to allopathy. In fact, when we looked at Ayurvedic remedies for heart failure, they're the exact same medicines that I use in allopathic medicine. The other part is Ayurvedic medicine actually offered you treatment which was very balanced because it was in keeping with natural existence of that medicine.
Okay.
So why can't I open my mind and say, you know what? Oh, is that herb working? Is that effective? Brilliant. Try that out. But why don't you give me the details of that herb? And now I can actually ask a researcher to figure out why that works. So it'll spur research into our own traditions. Let us not assume that allopathic medicine is the only branch of medicine. There's Ayurveda, there is Unani, there is traditional herbal medicine. And all these are time tested. In other words, they're not recent. Ayurveda has been around for more than 7,000 years. It goes back to our Vedas, which is 7,000 years ago, at least. They say 7 to 14,000 years ago. So if that is that long and it has survived, it can't be that it is hocus pocus. I'm a great believer that it is now time for us to rediscover what our civilization already had. And
That's
yes,
true.
going into the rural areas allows me to learn it again, to actually understand what was in the Vedas. Why did they treat certain conditions in a specific way? You'd be surprised, every modern disease actually finds a mention in our Ayurvedic texts, including cancer. Amazing, isn't it? How did they know about cancer 7,000 years ago?
Yeah, that's
But it did.
that's true.
And we have to learn. What I'm saying is we have to stop being arrogant to say that only allopathic doctors with my MBBS, MS, FRCS, DM, MCH degrees know everything. No, we should have an open mind. Because yes, we know the science, but let's learn about what we don't understand. Let us not just offhand discard Ayurveda or herbal medicine as, oh, we don't do that. Learn from it, and I'm sure we'll be able to integrate it over a period of time.
So, like, this can be one of the answer where all this technology, all this science come together with the help of technology can provide us a better solutions or better healthcare
Yes. It might not
solutions.
happen very quickly, but I think that is the way we have to evolve.
True,
Remember, today in allopathic medicine, we distill every chemical to its downright absolute molecule, and then we have a lot of side effects.
true.
Why can't we say that actually it is possible for us not to give it in its molecule form? We can actually give it in a way whereby it's naturally balanced in an Ayurvedic concoction form. The side effects might be taken care of because the other molecules that are present in that natural, herb or plant or root. But I get fascinated. I don't know the correct answer, but I'm
I
fascinated.
honestly, that's the reason I call you visionary because there are very few healthcare professionals who think like this. They are so stuck with their visions. Like, I am working with them since last 8, 10 years, and I know how they think. So that's the reason I call you visionary. On this, like, to conclude this podcast, if, like, you have to say what would be the first step or step toward this ideal village or ideal remote village which has all healthcare, how would you visualize or how would you picturize it?
So Abhi and I actually done this in practice, and let me just tell you what we did then. The first thing is we have to start believing that this is possible. And I'll tell you, about 4 years ago when we did this experiment, no one believed in us. But so we took two villages in Raigad district, and we
Okay.
said let's try whether we can save the villagers unnecessary visits to the town place. And you'd be surprised, Prajakta, 70% of the visits were saved. So if there
Oh,
were 10 visits happening, we brought it down to three. And people were so happy because a lot of their problems were getting solved because the data was going to the doctor in the city. He was giving
mm,
them exactly the same care as if they would have traveled in person. Now, that was a basic solution. Today, we've evolved to a stage where I am confident that the first thing we have to do is tell the decision makers that, hey, listen, look at what we can really help you with and go and start setting up your clinics in the rural areas. I promise you the acceptance is there. There is not going to be any villager who will say, I don't want this. Yes, we will find hostility from the local medical practitioners, but there is a way. We actually can make them a part of the journey. We can say, we will empower you. We are not going to replace you. But if we empower the local practitioner to be a specialist or connect to a specialist for the right advice or intervention, suddenly it starts transforming rural healthcare. So let's assume I've got a BMS or an MBBS doctor in the village, and I say, hey, listen, I'll help you do all the cardiology tests like a cardiologist would do, and you can even get a cardiology opinion in your clinic, where your patient will come back to you in the evening when the cardiologist is available, and he'll do the same consultation, and you will be able to look after your own patient without your patient having to go to the city. And only if he needs an angio, then I'll send him to the city. Now, suddenly, the doctor in the rural area feels much more empowered. He doesn't send his patient to the city. He can look after them because the cardiologist is holding his hands. The cardiologist is telling him, do this, don't do this, watch for this, watch for that. Now I'm quite happy to look after my own patient. So it is about thinking about what any individual practitioner can be empowered with.
this sounds like an ideal healthcare ideal village in ideal India, and we all are waiting for it.
So I would say it's a practical village in a practical India. We are known for our practical approach to life. It's way far away from idealism. In fact, we are the first people in the world who will find a solution for anything without spending money, right? So similarly, like I said, it's about thinking outside the box, creating a solution, going out to the rural villages and offering it to them.
This was quite enlightening, and honestly, this is like it's a proud for us, like an Indian origin doctor who is coming up with such health tech solutions which can solve lot of healthcare issues not only in remote area but any part of world and in any language. To conclude, I feel would like to say health tech can be a bridge to connect the divide between the remote areas and health. Imagine a healthcare reaching the remotest corner, AI empowered diagnosis, tool detecting the diseases, and drone driving the essential medicines. All this is possible, but with the collective efforts. Maybe the collective efforts of government, healthcare provider, tech companies, visionary doctors like Dr. Abhay, NGOs, all must come together. Thank you, Dr. Abhay. Thank you for an insightful and informative session.
Thank you,
Thank you so much.
Prajakta. My pleasure. And let's share a dream of India as a health superpower.
Yes. So, all of us, let's connect to next week with another thought provoking episode. Like, comment, subscribe to our channel. Thank you so much. Have a good day.